Welcome back to Let's Share. I'm your host, Molly Dasobre. Last week, we introduced you to the SHARE project. Today, we are discussing an interesting and essential topic, gender equality and its impact on sexual reproductive health and rights. Gender equality is just not a buzzword, it's a cornerstone to ensuring that everyone has access to reproductive and sexual health services. With me here today is Fauzia Aliu, the Advocacy Campaigns and Inclusion Manager for WaterAid Ghana, who is to give us an insight of the topic and how it relates to sexual reproductive health and rights. Welcome once again.
Thank you very much, Molly.
Oh, you look beautiful.
Thank you.
So I would just like to kickstart the conversation. What is gender equality and how does it relate to sexual reproductive health and rights?
Okay, so the term gender equality actually refers to a situation whereby every individual, regardless of their gender, have access to equal rights, equal responsibilities, and equal opportunities. When gender equality is actually also promoted, what it also does is that it takes away the access restriction of sexual and reproductive health services for women and girls. It's able to break those barriers such as stigma, it's able to break those barriers such as discrimination and violence, which reduces access to sexual and reproductive health services.
So would you say age is a barrier in the sector?
Age is actually a barrier. A number of the issue of stigma around who has access to sexual reproductive health services. People have that tendency, or society has that tendency, to look at young girls or even young boys accessing the service as children who are bad or who are into sexual relationships and activities. So it definitely is a barrier.
And would you have advice, like an age rate in which these services should be accessed by adolescents or young people?
Well, I would say that access to information around sexual reproductive health rights and the services that are provided by healthcare services should be age appropriate, in a sense that you don't go teaching a 2-3-year-old girl about sex or sexual and reproductive health rights. But then when you have children between 9, 11, and 10 who are maturing physically, there's the need to have education around it that is age specific or age appropriate.
So that because that's the age they get curious, when their curiosity is at peak, you try to certify that. So how does this gender inequality affect sexual reproductive health and rights services in our healthcare services or to the youth or the adolescents?
Well, I would say that there are several reasons or several ways gender inequality affects access to reproductive health services. So for starters, one, in terms of economic dependency, we find that most women, young girls, and even older people are dependent on their male counterparts for resources. So they are economically dependent on them. And what it means is that if the person doesn't provide the resources or the funds for the woman or the girl to seek sexual reproductive health services, they are unable to. That's one. The other one has to do with issues around discrimination and violence. What we notice is that it usually happens with people that they are intimate partners. So once there's the issue around violence for women and they are intimate sexual partners, they are unable to walk to a healthcare facility to ask for it. Exactly. And then when it comes to issues around birth control, who decides the number of kids, birth control, and also issues around contraceptives as well, and even abortion, right? So once women do not have that equal opportunity, then they are dependent on another person to be able to make those decisions, and usually they do not favor, research has shown that it doesn't really favor their access to reproductive health. The other reason
that
could also be legal and legal barriers and policy barriers. There are some policies in itself that are restrictive, and women, because of these policies, are unable to access sexual reproductive health services. For example, where we have in countries where we have policies such as restricted access to abortion, restricted access to contraceptives.
At a particular age, you are not
exactly. And this is as a result of that gender inequality, the idea that the woman is supposed to be taken care of by another person. So it definitely limits women's access to sexual reproductive health.
Okay.
And also the issue around cultural norms. One of the key things has always been cultural norms and traditional beliefs around reproductive health rights, where people in our society, we're looking at decision makers as men, but how much information do these men have around sexual, around our bodies? So to be able to give women control over their reproductive choices, what it means is that supporting gender equality means that they are economically empowered. That's one. They have the ability to make decisions, and also if there's reduced cultural norms, the negative cultural norms and stigma against access to these vital services, it improves health outcomes as well for both women and young girls.
If you're an adolescent out there and you need any information on your sexual reproductive health, do not hesitate to contact She Plus hotline on 0800 001 122 or any of the numbers on your screen. Thank you. Let's go to gender responsive actions that you have taken or that have been successful in our communities or societies.
Well, so for one, I know issues around menstrual health, menstrual hygiene and health is one successful campaigns that we have run, and it has yielded a lot of results, in a sense that issues around stigma on menstrual health and hygiene is reducing. People are talking more around menstrual hygiene. Girls are no longer, a number of girls are no longer shy as a result of interventions, and it's also improving access to menstrual products and services around MHM. So those have been very successful. We can also talk of campaigns against child marriage, which is something that we are still working on. But in terms of reduction, we've seen a huge reduction around child marriages. So these are all successful gender equality and sexual and reproductive health campaigns that has been run. There has also been the one around maternal health, free access to maternal health services by the Ghana Health Service, to encourage women to walk into healthcare facilities to have safe delivery. So all these campaigns have contributed significantly to contributing to gender equality and improving access to sexual and reproductive health rights.
Okay. So you shared the work done around menstrual hygiene. You shared the work done around early child marriage. You shared the work done around maternal care. Can you just give us a little success story that you advocated for that really worked out in sexual reproductive health services, like access to those services?
Thank you very much. One of them I would say significantly is the menstrual health and hygiene. I would still go back to that. We've also run successful campaigns around designing healthcare facilities that are gender responsive and SRHR responsive as well. So those are huge success stories where governments, when they are thinking of designing a healthcare facility, they're beginning to think of access to wash, access to corners, adolescent youth corners, and also having that services that are gender and sexual reproductive health integrated, so that they are responsive, and we see a lot of reduction around maternal and child mortality recently. So you can attribute most of them to the successful advocacy work that we have done around this.
That is a lot of work, and we still hope for more advocacy around equal accessibility to sexual and reproductive health services for adolescents and youth. And I think we would want to just have your final say on how you would prioritize sexual reproductive health and rights in the SHARE project. How are you planning on prioritizing it, or how has it been prioritized?
Okay, so one of the key things I would advocate in terms of trying to have programs that are sexual and reproductive health oriented, one of the key things for me would be mainstreaming gender in the design of the project. So whilst you are planning the project, whilst you are implementing, and also through to evaluation. So one of the key things I would say is that you need to have it at the start, even at the concept stage, when you are beginning to design the program. It shouldn't be an afterthought or something. Let's say, okay, let's integrate. No, let's mainstream it. Said that the program's policies, the project design and everything speaks to gender equality and how that can improve access to SRHR. That's one way. There's also that need to constantly do analysis of gender in the project from even before the start of the project, within the project, and the final assessment, because that final assessment produces information to support other projects that can be done. So there's the need to ensure that we are doing constant analysis to generate new information to shape the project as we move. The third, I would say, is around ensuring that the project is participatory, in a sense that it ensures that the needs of all genders are catered for in the project. Through implementation, we're looking at access numbers, we're looking at quality of services and how that translates or transforms gender equality. We're also looking at programming that looks at building capacity. So we don't assume that people have capacity to deliver SRHR programs that intricately links gender equality. You have to purposely plan for it, build capacity around gender equality if you want to have effective outcomes of the SRHR program. So for the SHARE project, one of the key things that we're doing on that project is ensuring that we are targeting adolescent girls, and not just girls, but also boys. That's why I said it has to be participatory. Because when you want to address issues around gender, you don't have to always look at the women and the girls. That male involvement is also very critical for us to achieve the level of services that we want. Finally,
she's advocated. She's advocated. Okay.
Yeah. So finally, we would look at system strengthening. One way is to build gender equality in SRHR systems, policies, programs at the national level, and then through to the district and even community level. So that's one key way you can go about it in order to have gender intricately part of designing an SRHR.
And making it a priority of sexual, reproductive health and rights. How do gender equality issues affect you in your community? Leave your answers in the comment section. Thank you, Fozia, for joining us. It's been an interesting discussion. Thank you all for being part of today's discussion on gender equality and its impact on sexual, reproductive health and rights. Join us next week as we discuss the barriers in accessing sexual reproductive health rights services. Don't forget, knowledge is power. I'm your host, and you have been watching Let's Share.